All right, we're going to talk about some Medicare changes today in terms of original Medicare Part A, Part B, Medicare Advantage, the prescription drug plans. Not much with Medicare supplements, but we've got Ari here from Chapter Medicare. So we'll just spend the next hour answering any and all of your questions. As usual, this is a 100% live. If you're watching this on a video later, make sure you subscribe and like and do all that kind of good stuff so that way you can find us in the future in case you have any other Social Security type questions. This is predominantly a Medicare live Q&A today, but if someone has any crucial type of Social Security type questions about retirement, survivor benefits, Ari, you don't mind if I jump in there and help people out on that part, right?
Not at all. It's great to be back with you and your audience, Dr. Ed.
All right, good deal. Thanks for coming back. All right, so we're going to do this on a regular a couple of weeks. Every couple of weeks, you're gonna join me and help people through the Medicare maze, right?
That's the goal.
All right, perfect. I like it. I like it. All right, so I guess what's in the news about Medicare? I heard they pretty much doubled payments to Medicare Advantage plans. So I guess the stocks on those companies went up considerably.
That's right.
But what about out there on Main Street? How is that going to help people going forward, do you think?
So the news that Dr. Ed is referring to is the proposed rate increase for 2026, which the Department of Health and Human Services announced would be just north of 5% in comparison to last year when it was about 2.3%. So it about doubled, as Dr. Ed mentioned. Now, how should this affect benefit design, plan design for 2026? Well, this is for Medicare Advantage plans. So for those who are listening, there's two types of plans. Remember, original Medicare only covers 80% of your medical costs. The way to get comprehensive coverage is to choose either a Medicare supplement and a standalone prescription drug plan, or a Medicare Advantage plan. It's one or the other. So this rate increase is for Medicare Advantage plans. And it should increase benefits when these carriers submit their plan designs for 2026. We won't know until the fall when it's time to shop your coverage for next year. So this is all news where we'll find out in the fall as to how it impacted your benefits.
Yeah, and this is what I tell people all the time. It looks like we already got a question on Medicare here, but people often ask, and I'm sure they ask you all the time, how can these Medicare Advantage plans, zero premium, free? Which you're not supposed to say free because it's not free. The reason it's not free, but it can be zero premium is because you already paid for it. It's like you ordered, either you ordered a Ford Pinto back in the 1960s and 1970s, or you ordered a Ferrari. That you ordered it many, many decades ago, but now you're going to pick it up when you're 65 years old, and it depends on what you demand is what you get, because all those decades you paid in a FICA. FICA includes Social Security, the 6.2%, and then Medicare, the 1.45%, and then your employer, whatever, pays all the rest, the other part of that. So you've already paid for that Medicare Advantage plan for decades and decades and decades out of your paycheck. Now, when you turn 65 and you're eligible for Medicare, if you decide to sign up with one of those, then it's a zero premium. A lot of them, some of them aren't, but some of them a lot of zero premium. And then what happens is, I always say the CEO goes to Washington, D.C. with their little begging bowl and say, hey, we just signed up Sonia here and give us that money. And that's percentage, that increase is an increase of Sonia's money that she paid into all those decades, correct?
Well, there's two separate trust funds. There's one that is the result of payroll contributions, so people paying into the system. That's for Medicare Part A, which is your viewer's hospital insurance. Then there's Medicare Part B. That's outpatient coverage, so everything outside the hospital, including durable medical equipment, but it doesn't cover prescription drugs. We'll talk about that in a second. For Medicare Part B, there's a monthly premium, and that premium for this year is $185 per month. And even if your viewers choose a $0 Medicare Advantage plan, they still owe that $185 per month to the government. It doesn't go away. The only way it would go away is if your viewers also qualify for Medicaid.
And we'll talk about that as well some today. I'm sure we got a lot of questions about Medicaid and the future of Medicaid. It's all stuff kind of all up in the air right now. Okay, so let's get into her question real quick, and then we'll kind of circle back here. I have moved my retirement to July this year. Should I sign up for Medicare now? If you are 65, then you have to make that decision. So you want to tell Sonia what her options are in terms of 65, whether she's working and all that stuff, Ari?
Yep. So, Sonia, if you're turning 65 in July, then you're presently in your initial enrollment period, which begins 3 months before the month in which you turn 65. And so, if indeed you're retiring to coincide in July with your 65th birthday, then now is a great time to sign up for Medicare. Your benefits will start July 1st. Alternatively, if you're past age 65 and you're just looking to time your retirement with when you start Medicare, then I would probably wait until next month in order to alert the Social Security Administration that you're intending to retire. The reason why is because your work provided coverage probably extends until the end of July. So we wouldn't want your Medicare to begin until August 1st. So it just depends on whether you're approaching 65 or you're already past 65 and coming off your work provided coverage. And sorry, my lights just turned off in my office. Normally, I have my nice AV setup to use with Dr. Ed, but today it just wasn't forgiving to me. It just wouldn't turn on.
It's the old Marine Corps saying, improvise, adapt, and overcome. Okay. All right. Yeah. And on anything nowadays, because of, Social Security is at a low staffing for 50 years, and it's even worse now because of all the cuts in the agency and all the people they kind of being moved out. So anything like that, if you're planning on setting up for Medicare, you're losing your health insurance from work, and you want to go ahead and sign up for Medicare. If you want to sign up for retirement benefits, whatever you're going to do with the Social Security Administration, you have to make sure, if at all possible, you plan it ahead of time, because the delays are crazy. I'm sure you've already recognized that we lost Ari there. That you already recognize that there's a 3-hour wait to get into the phones, and so it's not going to be fun. So you just have to make sure you take allowance for all of the delays. Okay, I'm going to we'll do a quick Social Security question here. I'm eligible for widow's pension if I'm retired and receiving benefits. Yeah, if once you retire, in terms of early retirement, you just have to stay under the annual earnings limit, the $23,400. If you're under that, yeah, you can receive widow's benefits. You can receive benefits on your own record. Anything over that, they hold back $1 for every $2 you go over. What a lot of people do is they depends on the numbers, but you can go ahead and collect widow's benefits, also called surviving spouse benefits. Get those surviving spouse benefits. Don't touch yours, and your benefit continues to increase until you are 70 years old. So, Ari's back. Yay.
I appreciate it. I'm so happy to be back.
All right. Will we still be getting our checks? Are the slashing Medicare? Yes, checks are still coming. Doge or nobody in the Social Security Administration could ever stop your checks. Going back to 1935, the only people that can stop your checks are your elected representatives, Congress, and they're the ones that can cut your benefits or stop your benefits or whatever the case may be. They're the ones that make the laws. Social Security is, the agency, the employees there are just the ones that administer the laws. So, the Congress makes. But, we've got a computer system that is, Social Security has been begging for decades to update, and Congress continually refuses. And now they're going to go in there and do something, and just hopefully they don't do anything that's, nobody pushes the button and does something wrong. So Alan has a question for you, Ari. Are there any dental plans you recommend? Are they all Plan G type plans?
All right. This is a fun one. So, Alan, under original Medicare, there's no coverage for dentistry. There's also no coverage, by the way, for hearing or vision, if it's corrected vision. So, because Medicare Supplement sits on top of original Medicare, if original Medicare doesn't cover dental, vision, or hearing, then your Medicare supplement plan wouldn't either. So this is one of the use cases. This is one of the reasons why someone might gravitate towards a Medicare Advantage plan if they value those additional goodies like dental, vision, or hearing. That said, it's never worth sacrificing your 3Ps. It's never worth sacrificing your doctors being a network, that is your providers, your prescriptions being covered affordably, or your priorities, like if you have a home in a different state or your grandchildren live more than 50 miles away. Those would all be reasons why it wouldn't be worth choosing a Medicare Advantage plan just for the dental, vision, and hearing benefits. So one way to get dental, vision, hearing covered would be through a Medicare Advantage plan. The other way, if you're on a Medicare supplement plan, which it sounds like you are, would be to add a standalone dental or vision plan. Candidly, these often aren't a good value for you. It's less expensive to self-insure and pay out of pocket when you go to the dentist for a cleaning, especially if you have a long-established relationship with a dentist and they just wouldn't take your standalone dental plan. So really, a standalone dental plan might be something worth considering if you have Medicare supplement, but it needs to meet your bottom line. It has to be cost advantageous to you. We don't want an extra penny going to the insurance company that would be better in your pocket.
I like it. I like it. Let's see here. Kind of a follow up. I heard that Medicare will pay a portion for glasses if you have cataract surgery. Is that true?
Yeah. So remember, original Medicare doesn't cover corrective lenses. However, it does cover cataracts typically, and it covers anything that's medically necessary. So this would be potentially a use case where you could get some coverage under Medicare.
All right. Good deal. Good deal. And then let's see here. Oh, this is a common one that people mess up on. So if you have a Medicare Advantage plan, you don't need a supplement, right?
Yes, that's correct, Ange. It's one or the other. You either have Medicare supplement and a standalone prescription drug plan, or you have Medicare Advantage. It's one or the other. You can't have both.
All right. Perfect. Yeah, it's funny. It's a little side story. I had cataracts when I was like, what, 39 years old, and the doctor
Wow, that's
says,
young.
"Oh, yeah, I know it, right?" Yeah, he asked me. He said, "Did you bring your pediatrician with you?" I'm like,
Yeah, I've never heard of a 39-year-old having
yeah, yeah,
cataract surgery.
yeah. Being outside every day when you're in Florida in the sun, I guess it ruined me. Anyway, and
That'll do
all
it. I need to be wary of that here in Arizona.
yes, 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 definitely. Yeah, the kids don't have to worry about it nowadays because they don't go outside, right? Now it's yeah. When
So
we
I've
were
heard.
young, yeah, go play on the highway. Um, it almost doubled for 2025 in my area for Medicare Advantage plan, California. Yeah, 2025 this year. I
Mhm.
see a lot of people that missed. I tried to do the best as we could during the last the enrollment period from October 15th to December 7th and tell people that 2025, the plans that are, in effect this year, they are really, really different. There's, companies that left entire states, that left
That's right.
areas, that just dropped people. Was it millions of people just lost their Medicare Advantage plans,
Right.
and it was a golden opportunity to switch to the ones I recommend as a Medicare supplement, a Medicare N or a Plan G, if it's right for you. But a lot of people are reaching out to me and they say, "Oops, I didn't make the December 7th deadline." So for people like that, have finally realized that what they have is not what they need, is
Mhm.
there anything they can do now that it's April here?
Right. So the Medicare Advantage open enrollment period ended March 31st. That said, if you have a change in circumstance, it would certainly be worth reaching out to our team. We'll do our best to help you. And if we can't, then we'll set an appointment for the fall, which is the annual enrollment period.
Perfect, perfect. Yeah, so there's all kinds of, if you move, if you lose Medicaid, if you're gaining Medicaid,
Mhm.
there's and with the Medicare supplement plan, you can change those, any time of the year, right?
You can shop your Medicare supplement plan at any time. So if you were turning 65 and you signed up for a Medicare supplement that costs an arm and a leg, we can actually do a price comparison for you.
Perfect, perfect. And said, let's see, she said, have a friend that's 65, number one, awesome for looking out for your friends. Doesn't have health insurance with his employer, so he's paying 185, but doesn't have Part B. No, that would be a terrible coincidence because Part B is $185. So therefore, yeah, he does. Your friend does have Part B. If you know,
And
don't
I
you?
appreciate you looking out for your friend. It's important here. If they just have Part B, though, then they only have 80% coverage for their medical expenses. So it still might be worth helping your friend make sure that they get comprehensive coverage, which means choosing Medicare Supplement and standalone prescription drug plan or a Medicare Advantage plan.
Perfect. All right, yeah, the original Part A, Part B is awesome, but yeah, those 6 gaps in there, those financial gaps, definitely need to be covered unless you've got a few $1,000,000 under your mattress someplace. Emmy says, has anyone in April gotten a pay hike in their Social Security for April? I got mine $23. That's probably, yeah, $23 is $23, right? Almost a gallon of gas nowadays, right? But that's probably because you worked last year. That's obviously not a COLA because the COLA would have been, effective starting January. The $23 is probably because you worked last year. And then what happens is once the Social Security Administration finds how much you worked the previous year, they do the calculations and they look at your high 35 years. And Emmy, I guess you worked and last year was one of your high 35 years. So they recalculated everything and gave you some extra money. And that extra money, you're probably not going to get $23 extra every month. That $23 was probably retroactive going back to January. So your benefit amount might be, $2 or $3 or $4 or $5 more, and they gave you a few months, and then you're going to get a few dollars extra every month going forward. So that's always, hey, extra money is
And
extra money.
Dr. Ed,
Let- sure.
Social Security, the check typically lands on or around the 20th, right?
It really depends. So if you're on SSI, you usually get it on the first of the month. That's a supplemental security income. If you're kind of grandfathered in, it usually comes in the third of the month. But usually nowadays, if you're born the first 10 days of the month, you get it on the second Wednesday of the month. If you're born on
Mm.
the second 10 days, you get it on the third Wednesday. If you're born on the last part of the month, you get it on the fourth Wednesday of the month. So. All right, and Bonnie says, "Please make sure you press the like button." Yes, please, please,
And
please.
I'm going to make sure to turn the lights on in my office. I'll be right back.
All right, no problem. All right, let's see here. We've got a Cameron on SSDI at 57. I have Part A only, not Part B or pharmacy. Am I paying a premium besides the current Part A coverage? So Cameron got SSDI or got Medicare based on her SSDI, that she was on SSDI for 24 months. And then they signed up for Part A automatically. But you must have refused Part B. And what do you say, Ari? Was that a good choice or a bad choice?
So Cameron would have qualified for Part B once they received cash disability. So yeah, I'm also inclined to think that Cameron may have declined Part B based on the question.
Yeah, so probably if you just declined it because you didn't want to pay the $185, then yeah, you might be in a little bit of trouble there. You might have to pay a penalty. But if you declined it correctly because it's probably not you because you're on disability, so you probably don't have health insurance from work, but maybe your spouse currently has health insurance from current
Right.
work, and the group health plan has 20 or more employees. And if that's the case, then you did the right thing and you declined Part B, and why waste $185? But if that's not the case, then yeah, you need to reach out to Ari's team and see what you can do to get that fixed. You might be stuck. The annual enrollment period, their general enrollment period ended March 31st. So maybe the only thing you can do is wait until January. But Ari's team can help you out on that. Just give them a call and
Yeah.
yeah.
Fun fact: the large group employer exception for uh, someone who's on disability is 100 employees. So if the spouse's employer has 100 or more employees, then it would be okay to remain on that in lieu of taking Part B.
Yeah, but that's what's
For
the
anyone else,
large
it's 20 or more.
20. Okay. All right. So who determines the size of the company? Because when people used to come into the Social Security Administration and provide that 40B and the 564 and everything, or the 564 particularly, yeah, it didn't have that on the form. We just took it in and we just put it in the system and it was done. We didn't make
Right.
that decision. So
Right. It's the number of employees that the plan is, or excuse me, it's the number of people that the insurance is offered to, and the determination is made by the group benefit coordinator at your employer or the HR person.
yeah. But once they fill out that form and take it down to Social Security, there's nobody there to really nobody checks that. I don't know if you know that. They just look
No
at the
one checks
form.
it?
No,
Really?
yeah, they just look at the form and the 564, and they said, "Did you have health insurance through current work?" And it says that on the form that yes, and it just stopped, last month. And there on the 564, it doesn't have, did we have 20 employees or 100 employees or anything like that?
Dr. Ed, I bet there is a department at Medicare that checks it. I think it would be the Benefit Coordination and Recovery Center because they have to list which is primary and secondary. And so I think there is a department within Medicare that is looking at it, even if it's not Social Security,
Okay.
that's
Yeah,
making the determination.
because I can guarantee you, I've taken in hundreds of thousands of those, and yeah, we just look at that date. Did you have health insurance? Yes. Your employer filled it out, and we put it in the system and let Medicare figure it out the rest. So yeah, just a insider FYI.
No, that's a good, that I did not know.
Yep,
Thank you.
yep. Suzanne, would it be beneficial for those of us who are receiving and can work to go back to work due to Medicare's instability? Um, yeah, Medicare, there's no real instability in terms of Medicare. We don't see anything, happening necessarily with Medicare. There's a lot of talk about Medicaid, but we don't know what's going to happen. But this is an important thing. If you know anybody, there's tens of millions of people on Medicaid, people that you wouldn't think were on Medicaid. The elderly, disabled, children, um, you know. Uh, mothers with children, people that are working that their companies don't provide good health insurance and they got low income. So there's millions of people on Medicaid, maybe someone and our politicians, our representatives are talking about making some type of cuts under the guise of fraud, waste, and abuse. So if you don't want Medicaid, if you, whatever you think, then it's this. I think this is the time to contact politicians and tell them whatever you think. So whatever that decision is. But in terms of Medicare, yeah, I don't think if you want to go back to work, you go back to work. But I don't think there's any Medicare instability that would dictate anything like that. Do you see anything like that, Ari?
No, I haven't heard of any instability with Medicare. Of course, we've all heard of the cuts to Medicaid that had been proposed. There's been nothing passed, by the way. These are just proposals that have been thrown around. But we'll see what is actually passed, if anything is passed by
Right.
Congress that cuts Medicaid. But I haven't heard of proposed cuts to Medicare. I've heard of some minor adjustments. Dr. Ed and I were talking about this before. The Biden administration had proposed covering weight loss medications. Nothing had been formally approved by the Center for Medicare Services, but the Trump administration clawed that back at the beginning of the month. So I don't think we'll see coverage for weight loss medications if the purpose is for weight loss, such as Ozempic, Wegovy, you name it. But those
Right.
medications, if you have type 2 diabetes, they would be approved for that use commonly. Or we could help you
Right.
get prior authorization from your doctor.
And I think they just came out something. I just saw something in passing today about they are going to stop compounding of those type of drugs. So they're not going to allow compounding anymore. That's where you go to some, local pharmacy and they say, well, the drug is made up of this, that, and the other, and they make some concoction
Mhm.
that's similar to that. And I guess they're talking about that not being able to happen anymore. So,
Hmm.
but We'll keep an eye on that for you. Make sure you subscribe and like, and that way we can keep you up. Is there a Medigap plan that covers overseas, like expats living abroad?
So, a standard Medigap plan, specifically, I'm referring here to plan letter types F as in Foxtrot, G as in George, and N as in Nancy. Those Medicare supplement plan letter types are standardized under federal law. And they include 80% foreign travel emergency when you're abroad for the first 60 days outside the United States. So if you're an expat who's living abroad, you're outside the United States more than 60 days consecutively, in which case, no, the Medigap plan would not provide coverage there. Now, there are some Medicare Advantage plans that cover travel clinics when you're abroad, or emergency care, or urgent care, rather. So it may be worth considering a Medicare Advantage plan if you're abroad. But of course, the question really becomes, what's your coverage while you're in a foreign country? Are you under a national healthcare system, or are you purchasing a private plan to cover you while you're abroad? So lots of things to consider, and this would be best. You'd be best served by having a one-on-one conversation with an advisor.
Perfect. Let's see. I was paying $3,000 more per month with A, B, and G was killing me for long-term care here in California. $3,000 a month for a G. Yeah, I don't. Maybe it's the long-term care type thing. Maybe they're paying for long. Yeah, because I've never heard of G being more than a couple of $100 a month or something, right?
Yes. So even if this person made millions of dollars and is a high earner, the most that they'd be paying for Medicare would be $628.90 per month. And then the Plan G in California wouldn't cost more than $150 to $200 per month, depending on the person's demographics. Would need to know a little bit more. So I think the question is really about long-term care. There's no coverage under original Medicare for long-term care. It does not cover long-term care. There have been proposals in Congress to add long-term care to Medicare. It would bankrupt the system. They haven't made it out of committee.
Yeah.
So I think what the question is referring to is the cost of nursing care, custodial care, 24/7 care. Those are things that Medicare does not cover, unfortunately.
So for long-term care, if somebody's looking at that, they need to find some type of policy that covers long-term care. And those are pretty much, they used to be popular a few decades ago, but not so much anymore because they're just way, way too expensive. So I guess the only option is, if that ever happens, you see people all the time, they go ahead and, or they're put in nursing homes and they just kind of dwindle down their savings. And then they're put through Medicaid. And this is another thing that, any potential cuts to Medicaid is going to affect a lot of people in nursing homes and that long-term care. And then there's there's a 5-year look back in a lot of states. Some
Right.
states have ladybird laws where they can come after your house. They can't come after it while you're living, but once you shuffle off your mortal coil, then the state, if Medicaid paid for your nursing care, then they can come back and get your house and use that to pay off the state taxes, correct?
Yes, that's right. And here it would just be helpful if you would connect with an elderly law attorney. They're going to be the best source of information for setting up a Medicaid asset protection trust, like Dr. Ed mentioned.
There you go. I like it. Yes. Neither of us, well, you're actually an attorney, right?
I am, but I
But
can't give legal advice.
there we go. I knew you were going to add that.
Just Medicare.
All right. All right. I'm a doctor, but I'm not that kind of doctor, so I cannot give medical advice, and he doesn't give legal advice, and neither of us give tax advice. So
No.
yep. So we know our lanes, and we're going to stay in it. All right. My wife is 66 in November, still working, but with Medicare. What month do you recommend to apply for Social Security? If she's 66 in November, if she's still working, then she might be, if she's 66 in November, she's still under her, she's not, her full retirement age sounds like it's going to be next year. So if she's going to stop working in November, then she can start benefits in November. because a lot of people miss this. There's a difference between the annual earnings limit and the monthly earnings limit. So let's say for her, she is going to work until November and she's making $1 billion a month. So that's obviously over 23,400. But starting in November, she's going to stop working or she's going to stay under the monthly limit, which is $1,950. So if she stops working or stays under $1,950 for November and December, she can actually start her benefits in November and get November and December. It doesn't matter what you make before you start your Social Security benefits. And then next year, her limit switches to, the numbers aren't out yet, probably about $63,000 or $64,000 that she can make. And once she hits her full retirement age, she can make as much as she wants. But in terms of actually filing, because she already has Medicare, she already signed up, she already did the difficult part, setting everything up. To turn on the money is super, super, super easy. So a couple of months before, you can go online or schedule an appointment, and pretty easy to get set up. So
Yeah, and you helped my mom turn on her Social Security. So thank you,
oh
Doctor.
yeah, thank you. All right, good deal. So hopefully everything, they treated her right, huh? The Social Security Administration.
They did. They made a phone appointment to help her sign up for her Social Security, but she did wait
Perfect.
on hold for 2 to 3 hours.
Yeah, that's got to be addressed. Yeah, that's unsatisfactory. Would there be any advantage for someone to drop their FEHB coverage and go to regular Medicare Supplements G or N? So that's FEHB, Federal Employees Health Benefit. So this person works for the federal government. You see any benefit for that, Ari?
Well, here's the problem with taking that approach, Joe. If you drop your FEHB coverage, you can't go back to it. So if you were to drop it in order to sign up for a Medicare supplement plan, you better be ready to marry that Medicare supplement plan and not return to your FEHB coverage. Alternatively, if you wanted to suspend your FEHB coverage, you could choose a Medicare Advantage plan, but you only have that suspension option if you go to a Medicare Advantage plan, not if you go to a Medicare supplement. The other thing to consider here is some FEHB FEHB retirees sign up for Part B. Others choose to forego it and just go with their FEHB coverage. We see it's about 50-50 actually, who choose Part B plus FEHB or just FEHB. So there's many different minds when it comes to this question. And the source of truth is going to be the Office of Personnel Management, because they publish the guidelines for your FEHB coverage. And they also have, I believe, a whole department set up with to answer these benefit types of questions.
All right. Danny says, thanks for being here. It does a family inheritance affect my Social Security if it's over $25,000 a year? The only way anything like that would affect your Social Security is if it's not actually Social Security, it's SSI, Supplemental Security Income, which is the welfare-based benefit. But you're probably talking about retirement benefits or disability benefits or spouse benefits or surviving spouse benefits. No, an inheritance does not affect Social Security at all. So you are good there. Let's see here. How many months before Hub turns 65 next year should he start looking to see which Medicare plans or Advantage plans to check into? Thanks for all you do, and we'll be calling Chapter. Awesome. So when do you?
Nice.
What's the whole process? When do you recommend before they get their Medicare, before they turn 65? What
Yeah.
can you all help with? What's the whole process?
This person is on top of that. They are the early worm. And so great job doing your research. The early bird, they're the early bird, not the early worm. But it's a little early because your husband turns 65 next year. Great time to start looking into his options would be 3 to 6 months before the month in which he turns 65. That'll give us plenty of time to help him get his red, white, and blue card and get situated with the additional coverage of his choosing.
All right. So let's see. SSA enrolled me to Medicare Plan D because I got extra help automatically. So that's great. Extra help with the Medicare prescription drug plans. A few years ago, when they did the analysis, they said people with the extra help with prescription drug, which you sign up with the Social Security Administration. It's a really, really easy form to sign up. And if you're approved, a couple of years ago, they were talking about the average person saves about $5,800. I think it was over $5,000
Yeah.
in their prescription drug plan. But now because the kind of the donut hole is out and the max, it's people save less, but because they don't have to pay as much, so it actually kind of works out. But it is a great program that saves a lot of people. So this person enrolled in a Part D because they got extra help automatically, waiting for Medicaid to get a dual eligible plan. All right, so you, Jose, applied for Medicaid to get the dual eligible plan. I think I skipped over I skip over a lot of questions because we get way too many. But anyway, so I,
Mhm.
I I don't do it on purpose. I don't skip your question on purpose. Sometimes it's just anyway. But someone was saying they wanted to stop their Part B because they can't afford the Part B premium, the $185. So
Mhm.
this is what Jose was probably in the same situation, and millions of people are, and
Yeah.
that's what the Medicare Savings Program does.
Yes.
So how do they go ahead and apply for the Medicare Savings Program and get that taken care
So
of?
the way to apply for the Medicare Savings Program is to apply through Medicaid, apply for Medicaid through your state agency. And so this varies state by state. In Alaska, it's called Denali Care. In Arizona, it's called Access. But you want to go to your state Medicaid agency and apply for Medicaid. And the worst thing that happens is they say no, and you're not eligible because you earn too much in order to qualify. Each state has a different threshold as to what counts as an acceptable income, and you have to be below that amount in order to qualify. Now, Jose's question also addresses the Part D Extra Help program. So it may be the case that even if you don't qualify for Medicaid, you still might qualify for help with your prescription costs. This is called Part D Extra Help. And Part D Extra Help, if you qualify for Medicaid, the government will automatically turn on your Part D Extra Help. But if you earn too much to qualify for Medicaid, then you can also fill out a separate application to enroll in Part D Extra Help. It's through the Social Security Administration. And as Dr. Ed mentioned, this can help save upwards of $5,100 per year on your prescription costs. So if you are below the income threshold for extra help, I believe it's like 33,000-ish dollars, then it would definitely be worth applying for.
Yeah, that's you mentioned Denali Care and access and everything, and a lot of people miss that. They say, "Well, I don't care what happens to Medicaid. I can't get the Medicare Savings Program. I can't get them to pay the $185 because we don't have Medicaid in my state." It be, it's because, as Ari points out, it goes by a different name. So I've got a list here of some of the different ones: Alaska Denali Care. I wonder if they're going to change that to Mount McKinley Care. Anyway.
Oh my gosh.
Um, Arizona's Access, Arizona Healthcare Cost Containment System. Arizona, come on.
Yes. I've always wondered what
Medi-Cal,
it stood for. Thank you.
yeah. Medi-Cal is California is Medi-Cal, because
Yep.
Cal. Colorado is Health First Colorado. Connecticut is Husky Health. Delaware is Diamond State Health Plan. So these are all these are Medicaid. These are
Yep.
Medicaid.
Yep.
Arose by their name, right? Let's see. Florida is statewide Medicaid. Okay, they use the name. Hawaii is MedQuest. Indiana, guess what? Hoosier Healthwise, of course.
Oh, come on. It's
Kansas,
Hoosier.
yeah.
I'm from Illinois. I mean, it's Hoosier.
Yeah. Sorry, sorry about that. And it's not Illinois, right? Illinois. Yeah. Anyway,
Illinois.
yes. um. All right. So Kansas is Can Care. Louisiana is Healthy Louisiana. Maine is Maine Care. Massachusetts is Mass Health. Minnesota Medical Assistance. Mississippi is Mississippi Can. Missouri is MO Health Net. Nebraska is Heritage Health. Let's see. New Jersey is NJ Family Care. New Mexico is Centennial Care. New York is Medicaid. Let's see. Oklahoma, Sooner Care, of course. Oregon is Oregon Health Plan. Pennsylvania is Medical Assistance. South Carolina is Healthy Connections. Tennessee is TennCare. Vermont, Green Mountain Care. Medicaid. These are all Medicaid. Washington is
All
Apple
Medicaid.
Health. Yep.
Yes,
Washington,
Washington's is
Apple.
really hard.
Yeah.
That's a hard
Apple
one to
Health.
remember.
Yeah. West.
Also, Washington State, interestingly, set up a long-term care state program. So if you do live in Washington State and you need help with long-term care expenses, it would be worth seeing if there's help from the state with your long-term care costs.
Oh, awesome. Awesome. Washington is ahead of the curve there, huh? And guess what Wisconsin is?
Badger Care.
Badger Care. Yes, of course. All right. All right. Why are we forced to take Medicare if we don't want to? I stay healthy by living a holistic lifestyle. Why are we forced?
Suzanne, you're not forced to take Medicare. You can choose to forego it. There are consequences, though, if you do choose to decline Medicare. And that is if you need Medicare later on, then you'll be subject to a Part B late enrollment penalty. It'll be 10% for every 12 months that you went without it. So if you go 5 years without signing up for Medicare Part B, you'll be assessed a 50% penalty when you do sign up for it, and so on and so forth the longer you wait. So if you go 12 years, it's 120%. So that's the downside. There's a Part B late enrollment penalty if you change your mind and decide to opt into it later. There's also a Part D late enrollment penalty. And then, of course, if it turns out that you need some type of care through a provider who accepts Medicare, then you'd be losing out on what it could have helped provide for you. So even though Medicare commonly doesn't work with naturopath, for example, there are providers who practice holistically that still are within the Medicare program. It's just about finding the right one.
All right. So this is not me, Ari. TJ says Idaho is no indoor plumbing care.
No.
I'm just reading it. It wasn't me. So just for out there in our beautiful state of Idaho. Since they are cutting Medicaid, okay, Sarah, we don't know yet for sure, but if you don't want that to happen, make sure you reach out. But if one has dual Medicare and Medicaid, if they terminate Medicaid, do I have the option to choose a supplement if I have Kaiser? Good question. Good question. So whatever happens, but if in your particular case, you get lucky like our previous person and get a $25,000 a year inheritance from a long lost uncle and you lose Medicaid, the question is, can you choose a Medicare supplement N or a G, or what do you say, Ari?
Yes. So Kaiser is a closed network. So if you currently have a dual special needs plan through Kaiser and you lose Medicaid, then if you want to remain with Kaiser, you'd probably be well served by choosing a Kaiser Medicare Advantage plan to make sure that you have continuity of care with Kaiser. So Kaiser's a unique situation here because it's a closed network. So even if you were to sign up, even if you were to go back to original Medicare and sign up for a supplement plan, you wouldn't be able to use it at Kaiser because Kaiser is a closed network. And I saw a couple other questions about Kaiser, so I thought we'd just group them together.
Okay, perfect. Yeah, Kaiser's interesting. Yeah, they're actually one of the companies that kind of on the forefront of kind of employee health coverage. Kaiser was the one that built a lot of the ships in World War II in the Pacific.
I didn't know
And
that.
for their dock workers and the people building ships, they built kind of a health plan, and that's kind of why you've got the Kaiser Family Foundation that does a lot of research on health insurance
Sure.
and Medicare and everything like that. So yeah, they've always been kind of the tip of the spear like that. So
Yeah. Now, of course, if you have questions about Kaiser, want to discuss other options, we'd love to help you.
yeah, that's one one of the main reasons my son and I chose, because we looked, because a lot of people needed help with Medicare supplements and Advantage and the Part D and stuff, and because those are private companies, my son and I said we don't really want to do that. We want to help you with Social Security and Medicare Part A and Part B, but a lot of people needed help, so we looked throughout the country, and Chapter, I think we hit it out of the park, partnering with Chapter, because one of the thing is your advisors. I was trying to think of it. They're neutral. They don't care in the sense of if you pick this one or this one or this one or this one, it doesn't matter to them. Whatever is best for you, that's they care about getting the best one for you, regardless. Because we've got Michelle here that says an Advantage plan agent lied to me, said my doctors and pharmacy were in network. It was a nightmare getting it switched back to just Medicare and Medicaid, because that's the
Right.
stuff we've seen way too much.
Right. That's the horror story where look, if you're considering a Medicare Advantage plan and it does not cover all of the doctors that you want to see, then that is not the right plan for you. And a plan that coordinates between Medicare and Medicaid, that is a dual special needs plan, is a type of Medicare Advantage plan. So don't experience the horror that Michelle just went through. You need to choose, if you're going the Medicare Advantage plan route, then you need to have a plan that covers all your 3Ps, your providers, your prescriptions, and your priorities. And that's our North Star. We will always act in your best interest, which is a standard that doesn't exist in Medicare land, unfortunately. But we're fighting for it.
Yes, perfect. Yeah. You're the boss there is going up on trying to get all kinds of stuff changed and get some stuff improved, and so that is awesome. That is awesome. I have Medicare Part A, Part B, and D with extra help, waiting for Medicaid. Oh, okay. That's Jose again there. So we already answered Jose. Thank you again. Let's see. Can I switch from Medicare A and B to my husband's health insurance? I cannot afford a Medicare premiums now. So if they turn 65, they go ahead and sign up for Part A, Part B, they get a supplement or Advantage or Part D, or they're good. And then, like me, they get bored of being retired after a week or a year, and they decide to go back to work, or their spouse goes back to work and they gain health insurance from that work. What are their options?
So you can drop Medicare Part B and go on your work provided coverage. Now, if you're newly employed by that employer, then that would create an opportunity to enroll in that work provided coverage. But it sounds like this person, Ginny, doesn't have an open enrollment period. You'd probably have to wait for your husband's open enrollment period in order to drop Medicare and go back on his health insurance. The other thing I want to mention here, Dr. Ed, is that normally employers subsidize the cost of their employees' health insurance premium, but they don't subsidize the spousal premium. So it may be more expensive for you to go on your spouse's work provided coverage because they're subsidizing his insurance, but they're not going to subsidize the premium for yours. It really depends on the employer. And this is why it's important to do an apples to apples comparison between what you would get if you were to go on work provided coverage, or perhaps remaining on Medicare would be more cost effective.
Yeah. So that's people ask me that all the time. What's best, my current health insurance or a Plan G or a Plan N? And you really have to pull out both of the brochures and try to figure out what's going on and which was the best. But for her particular case, so if she gets an open enrollment period from her husband's employment, and then she's on there for 3 or 4 or 5 years, and she's stopped her, let's say she has a Medicare supplement, she stopped that, she stopped her Part D, she stopped her Part B, Medicare Part B, she still has Part A because you can't get out of that if you're currently receiving benefits. And then 5 years later, she re-enrolls in Part B. Can she pick all that stuff back up like a Medicare supplement G or an N, and will she have to go through health underwriting?
Yes, most carriers will allow Ginny to, at that point in time, choose a great number of carriers will allow you at that point in time to choose a new Medigap plan without answering questions about your health history to coincide with your reactivated Part B.
Okay, perfect. Let's
There
see.
are a couple carriers that won't, but a number will. So
Okay.
you should be okay.
All right. I was told my Advantage plan was charging more, so I switched, but my check was smaller anyway by $100. Yeah, not sure. Most Advantage plans are zero premium, but there are some that do charge. Possibly, there's $100. There's maybe the Part B give back. A lot of people, if we mentioned that if you're having a hard time, or you or someone you know is having a hard time paying that $185 per month, you can sign up for Medicaid and they will pay for it as part of that Medicare savings program. But there's another option. Those are the Medicare Advantage Part B give back plans. And if there's one available in your area, then it will pay a part of your Part B for you. So you mentioned $100. So maybe when you dropped that Medicare Advantage plan, that was a Part B give back plan. And so now you're having to pay that $100 themselves. Sound like my logic is kind of sort
Yeah,
of there?
that totally checks out, Dr. Ed. Debbie, we need to know more about your specific plan to figure out why your cost went up by $100 per month. So we'd love to help you look into it.
Perfect. I turned 65 in January. Am on Medicaid. If I continue with Medicaid and then the added Medicare, can the state of Arizona take my house when I die? Wow, I was going down the road there, and then we went off to the left field a little bit. But yeah, when you turn 65 in January, if you're on Medicaid now, then they essentially mandate you to go ahead and sign up for Part A and Part B. You'll get that. You'll be dual eligible. You have Medicare and Medicaid. Millions of people have both of those. And then you have the Medicare savings program where they're going to pay for your Part B premium, possibly. You'll have the prescription drug, the extra help with the prescription drugs. You'll be eligible for a Medicare Advantage dual eligible plan. And, in Arizona, there's hopefully something down there that's good that can give you some extra money and some extra benefits. But in terms of, that's the very last question. That is a state of Arizona type of law. Each state is a little bit different. So I would definitely check out, someone that knows something about Arizona law. You can't help on that, can you, Ari?
No, not on Arizona law as it pertains to this question, though. I'm not sure what many millions of people, as Dr. Ed mentioned, have Medicare and Medicaid. So I'm not sure what the concern over the government, over the state taking your house would be. It sounds like you legitimately qualify for
Yeah.
Medicaid. And then as you approach 65, the government will mail you your red, white, and blue card. And then you'll have Medicare and Medicaid once you turn 65 next year.
Okay. Perfect. Let's see. Since there is a penalty for not taking Part B, why the heck do they allow that at all and put people in a situation where they can get hit with a massive fees? Yeah, it's insurance. Just like, I don't intend on having an accident today, and so why do I need car insurance? If I could get all the money I paid back in the car insurance over the last several decades, I could probably buy 3 Ferraris. And I haven't had an accident yet. So yeah, it's insurance. So you're supposed to sign up for, Medicare Part A, Part B at 65, unless you have other creditable coverage. And you say, well, I haven't used it for years. I don't need it. I'm not going to use it. I'm healthy. Well, that pays for all the people that, do need it. And eventually, if you're lucky or unlucky, then you just might need it in the future. So.
Yeah, and Dr. Ed, on that question, there's a great back and forth in the comment section where Karima mentions that the concern over Arizona taking the person's house would come if they go into nursing care. But again, the way to work around these issues would be to set up a Medicaid asset protection trust and to consult an elderly law attorney.
Perfect. Yeah, because they have a lot of states. They have a 5-year look back, and you have to do that quick. So I'm going to go into nursing home next year. I have a relative going into nursing home next year, so let's go ahead and do that now. In most states, that's too late because they have that 5-year look back. So you have to do it 5 years before that, and so. I just applied for early retirement last night. Got a letter today. They have it pending approval and should get back to me in 30 days. Wow, that's pretty quick. So yeah, if you did it online or something, you got a kind of a computer generated thing that yes, we recognize your existence and we've got your application. Now it's the difficult part because someone on the other side, an actual human being, has to look at that, make sure it's all good, and then they go ahead and push the button, and hopefully everything should be okay as long as everything was filled out correctly. Does Medicare Part A and Part B cover a rotted tooth that needs pulling?
Teresa, it's unlikely that original Medicare would cover dentistry. Original Medicare covers anything that's medically necessary. So if the extraction were the result of needing dialysis, for example, which can happen, or in preparation for a kidney transplant, those are examples where original Medicare may cover dentistry in limited circumstances. But if it's just dentistry for extraction, unfortunately, original Medicare isn't going to cover that because original Medicare doesn't cover dentistry, vision, or hearing.
Except for super small exceptions on, some of you get an accident in jaw, so it's something,
Right.
Yeah.
Right.
So
Yeah.
still
We
looking
saw
for
that
that
on The Pit,
exception for male
if
pattern
anyone watches
baldness.
that show. Yes. Nope, it doesn't cover male pattern baldness. And yeah, it also doesn't cover prescriptions for weight loss, for example.
Right. So yeah, next time the boss of Medicare heads to Washington, make sure he puts that on top of his list. I really do appreciate it. So 65 this last December. Is it too late to get a supplemental even though pre-existing conditions? And right now it's April.
No. And thank you for prefacing it with that. The reason why is because True turned 65 in December, which means that they're still in their Medigap open enrollment right, which is 6 months from when they started Part B. We're in April. By my count, that is only 5 months that have passed from December to present. So you're not a day late or a dollar short. You can probably sign up for a Medigap plan without any questions about your health history. So no need to worry about a chronic condition. And just for context, the Medigap open enrollment right is the period where it's the 6 month period after you start Medicare Part B. So if you're within that 6 month period, then guess what? You don't have to answer any questions about your health history. So if you even have diabetes with high blood pressure, that can be considered a pre-existing condition. So if you know that you want to go the Medigap route, the best time to sign up for it is when you start your Medicare.
Perfect. So yeah, call Chapter immediately and get that ball rolling, and that way you've got plenty of time to figure out which plan is best for you and find your prescription drug plan and all that kind of good stuff. So awesome. Carla, I have Part D along with G. Good. A lot of people miss that. They sign up for a Medicare supplement, and then whoever helped them doesn't do the right thing and also signs them up for Part D, and then they're penalized later. So I see that way too many times. I have a really expensive copayment for my prescription, so I use GoodRx. Can I use the payments using GoodRx for the initial deductible?
Carla, this is an awesome question. It's great that you're shopping around to find the lowest prescription costs. Unfortunately, when you're using GoodRx, you're not using your standalone prescription drug plan. So those payments that you're making are out of pocket and they don't count towards your initial deductible.
Yeah, a lot of people ask me that, and you really have to run the numbers, and if your numbers work out right, then yeah, go for it. Some other kind of deductible, but if something happens towards the end of the year and then all of you have to get some other really expensive, it doesn't count. And remember, all of those numbers recalculate December 31st, right? So
it's based on the calendar year. Whether we're talking about the Part B annual deductible, which is $257 for this year, or your prescription drug costs, which of course would be subject to the $2,000 maximum out of pocket for this year. But remember, if you're using GoodRx to pay for those prescriptions, it's not counting towards that $2,000 maximum. It's also not counting towards your initial deductible for Medicare Part D.
all right. Let's see. Thank you, doctor. I was able to inform my roommate of her divorced spouse benefit. She's approaching her 2-year divorce anniversary. Should she start the application process earlier? Wait. Yeah, and nowadays I would definitely start it as soon as possible, but you can only start it about 3 or 4 months before you're first entitled to those benefits. So probably what she's talking about, the 2-year divorce, this is only for what's called independently entitled divorced spouse. That is, you filed for benefits on your own record, you're getting benefits on your own record, but you're entitled to divorced spouse benefits. And the 2-year divorce only comes into play when your ex-spouse hasn't filed for benefits yet. There's so many people walking around out there that are entitled to spouse benefits, but they think they can't get those spouse benefits because their ex hasn't started benefits yet. That is 100% incorrect. You can get divorce spouse benefits from your ex, even though they haven't filed. It's just those two things. That person has to be at least 62 years old, and you have to be finally divorced from that person for 2 years. So good.
Wow,
Bob Johnson helped her,
just learned a
helped,
lot.
yeah, helped the roommate and get some extra money. So that sounds like that's called for a dinner for you.
That's a good roommate.
Yeah, right. Exactly. They told me I earned too much to eat bologna and PBG sandwich all month long. Oh wow, yeah,
I'm
I,
sorry,
I
Russell.
yeah, I agree. In terms of Medicaid and you know, um, the the limits for income, particularly in some areas, just like in Social Security, if you're receiving disability benefits, you're allowed to work, but you have to stay under the substantial gainful activity. If you're, want to get Medicaid, you have to stay under certain limits. And those limits are sometimes not an issue if you live, in really, out in the country or out in the desert someplace and, really low cost of living. But people that live in the city and expensive areas, expensive states, yeah, they are kind of very tough. Yeah. All right, we are over an hour, and I think we started as usual. We got tons of questions that we're just not able to get to, but we want to keep this to an hour. And in a couple of weeks, Ari will be back, right?
Yes, yes, and thank you for bearing with me in spite of the technical difficulties and just great back and forth with your audience today, Dr. Ed.
They are awesome, and they always look out for each other and take care of each other. So we appreciate it. And thank you, Ari. And y'all have yourself an awesome day. And please, please, please take care of each other. Thank y'all. Thanks, Ari. Appreciate it.